In the trauma of being diagnosed and then surgery and so on, I didn't think much about the aftermath, but I woke up and I had a feeding tube, and initially it was a bit of a shock. I soon learnt that if I was to get any nourishment at all, then I'd have to adjust to it, and we did pretty fast.
You just learn to live with it for a few months, so.
Just like everybody does, really.
The first day I went home with the feeding tube, I did feel anxious, didn't feel normal having a tube sticking out of my stomach, but I was hopeful that that was going to be basically feeding me. Once my surgery took place, that it was going to make me get better.
I'd never eat in front of Alan. Just didn't think it was fair for him to see me enjoying a piece of steak or something.
Or a pizza.
Or a pizza. It was a bit difficult when the family or the kids had come over because I was cooking for them and poor Alan could probably smell the food but couldn't eat it.
The adjustment between not eating and taking your nourishment by tube, I mean, we're social creatures, it disappears. The eating part of your day is an important part, and it does disappear. So I certainly missed eating.
I didn't want it to connect the feeding tube when I had people around me because I was embarrassed.
Some of the common challenges that patients face is getting used to the idea that they have a tube on their body now, and then needing to clean and care for that tube. They'll also need to be very careful for preventing blockages, because blockages can happen. There's also stitches can sometimes come loose, and infections can also occur. With tube blockages, I think the most important advice is prevention. It's really important that you do water flushing before and after your feeds to prevent the blockages. The other thing to really be careful with is if your feed has finished, is to just be very quick with getting in and doing the tube flushing before the formula gets to dry out in your tube and create the blockage. In terms of pressure, you want a moderate pressure. We are trying to clean the tube, so we push with a bit of force, but we don't want excessive force that's going to damage the tube. If you do get a blockage, I suggest you try just warm water flushes with a little bit of a push-pull action, and sometimes that can dislodge. If you have trouble, you're going to need to contact your dietitian or your medical team for help and advice with this.
Stay calm. If it does become blocked, it will unblock, but do not stress out if it becomes blocked. It's normal, I suppose.
If there is leakage around the tube, then there are two issues we need to address. Firstly, we should aim to reduce the rate of the feed to reduce the pressure and back pressure onto the tube. Secondly, it's about skin care. So you should contact your doctor to see whether you can apply some barrier cream to protect the skin from the irritants coming out from the side of the tube leak.
I did have leakage, and that always made me feel like, ooh, what is that? But I would just clean it. I remember one night waking up and I found the bed was wet, and it being because the lid on the tube had opened up. So leakage was coming through the tube, and that it did freak me out, but there was nothing wrong with it. It was just put the lid back on and clean up the mess and get back to bed.
To maintain skin care, it's really important that you do this as part of a daily practice. So you'll be shown how to just wash around the area. This can be done in the shower just by making sure that the water runs around the tube and gets it clean, or you could do it just with a piece of gauze by just wiping around the area, and perhaps even using a cotton bud to get underneath the areas that need cleaning.
If the skin around the tube become red and inflamed and painful, then this can mean that the site is infected. You should then contact your doctor, such as your GP, so that antibiotics can be given to treat this infection.
The point where it penetrates your skin is pretty vulnerable, and it did get infected, but antibiotics and so on fixed it up.
There are stitches that attaches the feeding tube onto the skin. If the stitch happened to fallen out of the tube site, the immediate action should be applying some tape onto the tube to prevent it from falling out. Then you should contact a doctor, either your GP or the treating team, so the tube can be re-stitched and secured back onto the body. If that tube happened to fall out of your body, then you should contact your doctor as soon as possible, as the hole in the body can seal within 2 to 3 days. However, if prompt action is taken, another tube can be inserted and the situation can be fixed.
Some people find it mentally difficult to have a Jej tube. I think it's really important to remember that they are a short-term thing that will be needed to maintain your nutrition. So keeping in mind that it's really only short term, and talking to people about the challenges you're having and the emotional difficulties you're finding. In time they should get better, and it's just really important that you talk and let people know how you're feeling.
I did speak to people about what worried me, my concerns. I didn't keep anything, I didn't bottle it and try to do this on my own. It was a journey that my family unfortunately had to tag along and come along with me for the ride. I think I just mentally kept saying to myself, as much as I hated it, that it was a journey that I had to go through, because it was the first step of the journey of removing my cancer. I knew that by having that, it would make me be able to eat after my surgery, even though I didn't understand how it all worked after the surgery and how I would feel. But I was confident and put my faith in the doctors, and whatever they told me to do, that I would try to do, because I wanted it to work for me.
Not many patients like to have a feeding Jej tube. However, this is an essential component to help you to get through treatment, and it is only temporary, because before long you'll be able to eat and drink normal again.
The Jej tubes are a really essential part of helping you recover from your surgery. So using your Jej tube and really working hard to maintain your weight is really important. The Jej will help you achieve that.
It's reassuring the hospital, the staff, the doctors have this whole system making sure that you're kept in as good order as you can be to get through it all. So my advice is get on board, because you get it through it, and before you know too long, you're out and about and eating again.
From a carer's thing, you just, as you said, get on board and just do it.
It's the lifeline that keeps you going, really. It keeps you nourished.
I did get through it, and you will get through it.